Hey Vibhasha, it's been long time.
Yeah, Emily.
So how are you, dear?
I'm fine, and what about you?
Yeah. So we didn't post any videos in our YouTube channel since a week.
Yeah, Emily. Because I went to hospital.
Why, what happened?
Yeah, Emily. I got pink eyes.
You mean conjunctivitis?
Yeah.
So I think today we are going to discuss about conjunctivitis.
Yeah, Emily.
So guys, before get into the video, you have to subscribe to our channel and don't forget to turn on your notification symbol. So what is mean by pink eye? I mean conjunctivitis.
Conjunctivitis, also known as pink eye, is an inflammation of the conjunctiva. The conjunctiva is the thin clear tissue that lies over the white part of the eye and lines the inside of the eyelid. Children get it a lot. It can be highly contagious. It spreads rapidly in schools and daycares, but it's rarely serious. It's very unlikely to damage your vision, especially if you find it and treat it quickly. When you take care to prevent its spread and do all the things your doctor recommends, pink eye clears up with no long-term problems.
So what is the main cause of pink eye?
Several things could be to blame, including viruses, including the kind that causes the common cold bacteria, irritants such as shampoos, dirt, smoke, and pool chlorine, reaction to eye drops, an allergic reaction to things like pollen, dust, or smoke. Or it could be due to a special type of allergy that affects some people who wear contact lenses, fungi, amoebas, and parasites.
So is there any connection between sexually transmitted disease and conjunctivitis?
Sometimes results from a sexually transmitted disease, STD. Gonorrhea can bring on a rare but dangerous form of bacterial conjunctivitis. It can lead to vision loss if you don't treat it. Chlamydia can cause conjunctivitis in adults. If you have chlamydia, gonorrhea, or other bacteria in your body when you give birth, you can pass pink eye to your baby through your birth canal.
Ah. Really? So is there any types of conjunctivitis?
Yeah, Emily. Viral strains are the most common and maybe the most contagious forms. They tend to start in one eye, where they cause lots of tears and a watery discharge. Within a few days, the other eye gets involved. You might feel a swollen lymph node in front of your ear or under your jawbone.
So what about bacterial and allergical?
Bacterial strains usually infect one eye but can show up in both. Your eye will put out a lot of pus and mucus. Allergic types produce tearing, itching, and redness in both eyes. You might also have an itchy, runny nose. And other types are ophthalmia neonatorum, is a severe form that affects newborns. It can be caused by dangerous bacteria. Get it treated right away to prevent permanent eye damage or blindness. Giant papillary conjunctivitis is linked with the long-term use of contacts or an artificial eye ocular prosthesis. Doctors think it's an allergic reaction to a chronic foreign body in your eye.
So what are all the symptoms that have been present?
Redness in the white of the eye or inner eyelid, swollen conjunctiva, more tears than usual, thick yellow discharge that crusts over the eyelashes, especially after sleep. It can make your eyelids stick shut when you wake up, green or white discharge from the eye, itchy eyes, burning eyes, blurred vision, more sensitive to light, swollen lymph nodes, often from a viral infection.
So when we have to go to the hospital or call the doctor?
There's a lot of yellow or green discharge from your eye, or if your eyelids are stuck together in the morning, you have severe pain in your eye when you look into a bright light. Your vision is obviously affected by pink eye. You have a high fever, shaking, chills, face pain, or vision loss. These are very unlikely symptoms. Call your doctor right away if your newborn has pink eye, as it could permanently harm their vision. Your eye doctor may tell you to come into the office to be seen immediately. If you can't reach your eye doctor, call your primary care doctor if the pink eye is mild in an adult. If your symptoms remain mild but the redness doesn't improve within 2 weeks, you need to consult your eye doctor.
So can you explain me about how the doctor will diagnose pink eye?
Don't assume that all red, irritated, or swollen eyes are pink eye, viral conjunctivitis. Your symptoms could also be caused by seasonal allergies, a stye, iritis, chalazion, an inflammation of the gland along the eyelid, or blepharitis, an inflammation or infection of the skin along the eyelid. These conditions aren't contagious. Your eye doctor will ask you about your symptoms, give you an eye exam, and may use a cotton swab to take some fluid from your eyelid to test in a lab. That will help find bacteria or viruses that may have caused conjunctivitis, including those that can cause a sexually transmitted disease, or STD. Then your doctor can prescribe the right treatment.
So is there any treatment for pink eye?
Yeah, the treatment depends on the cause, viruses. This type of pink eye often results from the viruses that cause a common cold. Just as a cold must run its course, the same is true for this form of pink eye, which usually lasts from 4 to 7 days. Remember, it can be very contagious, so do everything you can to prevent its spread. Antibiotics will not help anything caused by a virus.
So what about bacterial?
Bacteria. If bacteria, including those related to STDs, caused your pink eye, you'll take antibiotics in the form of eye drops, ointments, or pills. You may need to apply eye drops or ointments to the inside of your eyelid 3 to 4 times a day for 5 to 7 days. You would take pills for several days. The infection should improve within a week. Take or use the medicines as instructed by your doctor even if the symptoms go away.
If it is an irritant.
Irritants. For pink eye caused by an irritating substance, use water to wash the substance from the eye for 5 minutes. Your eyes should begin to improve within 4 hours. If your conjunctivitis was caused by acid or alkaline materials such as bleach, immediately rinse the eyes with lots of water and call your doctor right away.
If it is an allergy.
Conjunctivitis tied to allergies should improve once you get your allergy treated and avoid your allergy trigger. Antihistamines, either oral or drops, can give relief in the meantime. But remember that if you have dry eyes, taking antihistamines by mouth can make your eyes even drier. See your doctor if you think your pink eye is due to an allergy. Your eye doctor may have you return in several days to make sure your pink eye is improving with the medication prescribed.
So how to care this pink eye?
Keep your eyes clean. Wash any discharge from your eyes several times a day using a fresh cotton ball or paper towel. Afterward, discard the cotton ball or paper towel and wash your hands with soap and warm water. Wash or change your pillowcase every day until the infection goes away. When you do the laundry, clean your bed linens, pillowcases, and towels in hot water and detergent. Keep your own towels, washcloths, and pillows separate from others, or use paper towels.
Can I touch my eye?
Use tissues to wipe, don't wear, and never share eye makeup, eye drops, or contact lenses. Wear glasses. And throw away disposable lenses, or be sure to clean extended wear lenses in all eyewear cases. Use a warm compress, such as a washcloth soaked in warm water. Put it on your eye for a few minutes, 3 to 4 times a day. This eases the pain and helps break up some of the crust that may form on your eyelashes. Limit eye drops. Don't use them for more than a few days unless your eye doctor tells you to. It could make the redness worse. Protect your eyes from dirt and other things that irritate them. Non-prescription artificial tears, a type of eye drops, may help ease itching and burning from the irritating things that cause your pink eye. But you shouldn't use other types of eye drops because they may irritate the eyes, including those promoted to treat eye redness. Don't use the same bottle of drops in an uninfected eye. It also helps to learn how to use eye drops the right way.
So I hope everyone understood about conjunctivitis today.
So if you have any doubts regarding this, you can ask me in comment section and follow me on Instagram, and I hope you are all doing well and be safe.
Love you all.